Here in Britain, the most sobering news. The highest ever daily death figure from COVID was reported.
More than 1,500, which means more people have died in this second wave than in the first.
A new high in COVID deaths, more than one each and every minute.
A new day is beginning in London, and intensive care doctor Zudin Puthacheri is about to start another gruelling shift.
Intensive cares are meant to be very peaceful places. Well, they aren't very peaceful places at the moment. Where there is a space, there will be a patient, and patients are flooding into a lot of hospitals around the country.
In England, a coronavirus patient is admitted to hospital every 30 seconds, the result of a faster spreading variant that swept across the country during Christmas.
So the average age is 58. 90% of our patients were fully independent before they came to intensive care. They were working people, they had lives, they had families, just like you and I. When a nurse holds the hand of someone who's dying, that person who's dying could easily be their husband, their wife. They're all our age, my age.
London's hospitals are near breaking point, caring for 50% more patients than during the first wave. There's not enough specially trained intensive care staff, so they're relying on staff from other specialties, as well as volunteers. About 40% have reported symptoms of post-traumatic stress disorder. Dr Puthacheri is part of the UK's Intensive Care Society, which is worried about the long-term scars of being stretched so thin.
It's difficult, and that then impacts back on the staff, going, I haven't done my best. I haven't done what I was trained to do, and I'm failing.
Do you think that some people might be broken by this?
I think quite a few of us are already broken by this.
But through the hardship, there is hope in the form of a vaccine.
A sharp scratch.
Some of the country's cathedrals have been converted into vaccination centres, offering potentially life-saving protection to the most vulnerable.
I'm a bit of a heathen, so I'm not a cathedral person.
I feel a bit safer. I do feel a bit safer. I live on my own, so, it's important.
In England, on average, 140 jabs are being given every minute, using both the Pfizer-BioNTech and the Oxford-AstraZeneca vaccines. A program that started in hospitals has spread to GP surgeries, pharmacies, nursing homes and convention centres. Throughout the pandemic, Boris Johnson's government's faced a common criticism that it's been too slow to act. But when it comes to the vaccine, the government believes it can shift perceptions. More than 4 million people have already received their first dose, and authorities here want to vaccinate 14 million by mid-February.
I fear that the organisation may fall down. It isn't easy doing this. People have to realise there are lots of difficulties.
Supplies are constrained, so to maximise the number of first doses available, the government's decided people should wait 12 weeks between jabs instead of 3 as originally planned. While trials of the Oxford vaccine suggest the delay may improve the immune response, such a delay wasn't tested by Pfizer and it's not recommended by the World Health Organization.
Well, I think that it's not ideal. It would be better to stick to what we really know from the randomised trials.
Dr Laith Alexander treats COVID patients every day in a London hospital and received his first Pfizer vaccine in December. His second dose has been pushed back by 2 months. While he's confident it will still give him protection, he expected 2 jabs in quick succession.
That was what was tested in the trials. That's what should give us the protection against the virus. So for me, that's quite an important sticking point. I guess both from a protection point of view and also from a medical ethics point of view, that was what my informed consent was given for.
I don't think there are any risks in terms of safety. If we have a desperate shortage of the vaccine, then having half the people you would otherwise vaccinate totally unprotected, that is more dangerous.
The Pfizer vaccines come under renewed scrutiny following the deaths of 33 nursing home patients in Norway.
We did see something of a pattern, that they were vaccinated. Next day, they felt ill, they had nausea, they had fever, and of course, we have to look into, could that be in connection with the vaccine?
Dr. Steinar Madsen is the medical director at the Norwegian Medicines Agency, which is now investigating. He says there have been similar deaths reported in Germany, Sweden and Iceland, but he says COVID-19 is a far greater threat than the risks that might be posed by vaccination. This vaccine's rolling out in the UK and pretty soon in Australia too. Should we be worried?
No, I will stress that we are not alarmed by this. We are all very sick and they're all very old, many of them terminally ill.
So the race to vaccinate the masses continues, but for many the benefits will come far too late.
Well, I think the vaccines offer us hope for the summer. The vaccines offer us a lot of hope for next winter, but the vaccines will make no difference to this winter in regards to patient numbers. We just can't get the vaccine into enough people.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.